beneficial things about the organic acid test is being able to detect the presence of Candida, other yeast toxins, and even pick up on things related to mold exposure in certain circumstances. So if you're a practitioner joining us, you might already be familiar with the organic acid test and how to utilize it in practice. If you're not a practitioner and kind of learning some things for yourself, utilizing the organic acid test is actually really important, because there's many different aspects of this test and how it can be applied and looked at with regards to different types of health issues. So this is an individual here where we're looking at page 1 of the organic acid test, and I apologize about the graphics. I actually I got a new computer and some new stuff that were loaded. I'm not quite set yet just on the image quality, so I took some screen captures. So it's a little bit blurry, but what you'll notice is on page 1 of the organic acid test, you've got 9 markers under the yeast and fungal section. 4 of them are linked to Aspergillus mold. 1 of them is linked to something called Fusarium mold. And then we've got markers that are linked to Candida, the most specific being the Arabinose. And so Arabinose, let me grab a pen. You see here in this individual, we've got an elevated level of Arabinose. Arabinose is actually linked to invasive Candida. Now, everybody's going to have a little bit different on their reference range. So the reference ranges on the organic acid test is less than 13 years of age, greater than 13 years of age, male or female. So it can depend on, who you're working with will determine their specific reference range. But a 146 of an Arabinose is fairly high. What you'll also see in this individual is they do have some markers for Aspergillus exposure, and those would specifically be 2, 4, and 6. Now, one thing to keep in mind is that when you get an elevation of 2, 4, or 6, or even 5, which this person's is normal, it's indicating Aspergillus mold colonizing within the digestive system. And we all can be exposed to Aspergillus. We swallow the spores, and if those spores get into the gut, they can colonize and grow, and then you get a production of these organic acids that is reflective of that exposure. Now, the thing from there is that people who get exposed to mold can also produce mycotoxins, and the mycotoxins are an entirely different kind of chemical picked up on an entirely different type of test. And these mycotoxins are actually separate from the mold. They get produced by the mold, but they can stay in the body even though the mold may no longer be present. So in this particular case, we've got high level of Aspergillus mold exposure. We've got invasive Candida. And we also have this other marker here called tricarboxylic, which is linked to Fusarium mold. Now, Fusarium mold is another type of mold common in food products, particularly corn products, and other grains. And the existence of Fusarium in the digestive tract produces a specific chemical called fumonisin. And that fumonisin, and the presence of it, will generate the production of this organic acid called tricarboxylic. So those are the 9 main fungal markers. Citramolic is linked to yeast, 3-oxyglutaric is linked to yeast, and then carboxycitric is also linked to yeast. Those aren't necessarily always species specific. It just kind of gives you an idea of yeast overgrowth within the digestive tract. The other thing to keep in mind is that when they say yeast and fungal markers, okay, the biological group of organisms is called fungus, which includes yeast, also includes mold. Candida is a type of yeast. Aspergillus is a type of mold. But Candida is not a mold and Aspergillus is not a yeast, but they all fall under the biological group of organisms called fungi. So as far as, let's see, okay, so there's a couple of questions here. Does supplement with Saccharomyces boulardii increase Arabinose titer in the oat? No, from my knowledge and my experience, it does not. Are digestive enzymes cultivated on Aspergillus an issue in mold-sensitive individuals? It should not be. You would actually really need to talk to the company who's making those enzymes. What it basically would mean is that there'd have to be mycotoxins that somehow get into the product and contaminate the product. And I don't have any specific information, of that actually happening. Okay. I'm just kind of learning myself here how to use this chat box. So markers 1, 7, and 9 are yeast markers. So let me go back. Yeah, so 1, 7, and 9. So 1 is linked to yeast. Marker 7 is linked to yeast. So Arabinose is a yeast. 9 is linked to mold. So tricarboxylic. So the easiest way to think of it is markers 1, 3, and 7, and 8 are linked to yeast, with Arabinose being linked to Candida, which is a type of yeast. 2, 4, 5, 6, and 9 are linked to mold. 2, 4, 5, and 6 are linked to Aspergillus mold. 9 is linked to Fusarium mold. So this is a good question. What might it mean if you test high for multiple markers on the oat and then have all zeros on the mycotox test on the same overall sample? So I've had a few circumstances like this where the mycotoxins were totally normal. So it may be that, and remember, every test you do is a snapshot in time. So it depends a lot of times on people's ability in the environments that they're in and how long they've been in the environment, how long they're being exposed to certain toxins for things to accumulate. There's also, you could look at both situations. You could get exposed to mycotoxins and be able to eradicate them, fairly rapidly if you have good, robust detoxification systems. The other scenario is you might have somebody who's very poor at detoxifying, so things are not being expressed adequately. So it was interesting. My wife and I did a test. We did a similar test a couple of years back where we looked at mycotoxins and chemical toxins. Now, we obviously live in the same home. We work in the same environment. And for the most part, we eat the same type of food. We also generally tend to exercise about the same level of intensity. Except the big difference between us is that I'm actually an easy sweater. So when I start exercising, it doesn't take long for me to start sweating. I've always been that way. Now, she will sweat, but she won't get as sweaty as I will, even though we might be working out together and doing the same exact workout. So one of the things I was thinking is that it's quite possible that in my body, I'm actually able to get rid of some of these chemicals a little bit more effectively, or maybe, robustly than hers. Not that she can't, but there is a mechanism of sweating that detoxifies these chemicals as well. So any questions you have as far as shipping of the organic acid test or collection, you need to direct those to the lab. I don't work in the lab. I don't work at the lab. So I can't really answer questions specific to, sampling and how things are shipped. That needs to be directed to the lab. As far as foods grown with Saccharomyces cerevisiae in people with mold sensitivity or other fungal markers, it's not as though that specific yeast is going to be producing a mycotoxin. You can always have people who might have an immune sensitivity. And this is one of the things I've seen where people have either a leaky gut kind of situation, or they have a lot of other fungal imbalances or bacterial imbalances where they may just generate a lot of immune chemicals to different types of things. We can see sometimes if you do, let's say the food IgG test from Great Plains, they actually have an IgG marker to Saccharomyces cerevisiae. And so it is possible for people to develop an immune reactivity to Saccharomyces cerevisiae, which is going to be found in things like, baker's yeast and brewer's yeast, where they can then react to that in other foods. So if that is found in other supplements, there certainly is the potential of an immune reaction. It's not really the same thing as a fungal toxin or a mycotoxin reaction. So marker 6 is the Arabinose. Okay, so this is going to be linked to Candida. It's not linked to a mold. Let's see if I can erase these. Okay, so this is going to be linked to Candida, not mold. I hope that answered that. Let me see if I can get rid of these guys. Let me go forward a little bit on this particular case. So in this individual, we also see elevations of various mycotoxins, okay? So you'll notice that this person had 3 of the 4 Aspergillus markers elevated on page 1 of the oat, which are linked to Aspergillus, and we have 2 of the 3 mycotoxins of Aspergillus on the Mycotox test. Ochratoxin being most common. We also have high levels of gliotoxins. So we not only have Aspergillus mold colonizing within the digestive tract, but we've got mycotoxins being produced from Aspergillus mold that are accumulating in the body. I've actually had scenarios where every marker on page 1 of the oat was totally normal, but a person had high mycotoxins. And that can occur because we know we can be exposed to mold. The mold can produce the mycotoxin. The mold could get treated or die off or disappear, but the mycotoxin it produced is retained in the body because it's a separate chemical. It's kind of like somebody, smoking a cigarette, right? And then accumulating toxins from the cigarette in their body, but they no longer smoke, but they still have retained the chemical toxins that cigarette produced by smoking it. It's the same thing with the mycotoxins. Now, this individual also had some other mycotoxins, mycophenolic, and even this one down here called zearalenone, which comes from Fusarium mold. Not everything on the organic acid test on the yeast and fungal section is a mold that you will see. There's not going to be, the way I'm trying to say it is, there are certain mycotoxins that could come from Stachybotrys mold, for example. There is no corresponding oat marker for that. So the point about these mycotoxins is that when you want to evaluate for mycotoxins, you need to do the mycotoxin test. Don't assume that the mycotoxins are going to be normal just because the mold markers on the organic acid test are normal. What the markers on the organic acid test are telling you with regards to mold is that the person was mold exposed and the mold is colonizing within the digestive system. Okay, it still could be that a person has mold in their sinuses, mold in their lungs, for example, that may not be reflected on the organic acid test. And these mycotoxins are separate, are different from the mold. Yes, they were produced by the mold, the Aspergillus, for example, but the mold could be gone, but the mycotoxins can still remain. Let's see. Okay, let's see. So the thing about a person, if only one Aspergillus marker is mildly elevated and marked in red, can that be attributed to food? And I would say maybe. It's possible. There's no way to tell with absolute certainty in all circumstances that, a mold marker off of the oat is going to be 100% related to food or environment. The one thing that a take-home message that I learned in this process, and I've listened to Dr. Shaw a number of times, when you look at the regulatory agencies in the United States, when it comes to food, like the USDA, they do a pretty good job at regulating or attempting to regulate against excess mold production in food products. And one of the reasons for that is when they ship foods to other countries, they don't want moldy food. Okay, that's one of the ways that another country will forbid food from coming in if it's moldy, because they know that the mold can also have mycotoxins. So it's not a perfect system, but they, for the most part, they seem to do an okay job. I mean, certainly if somebody leaves a bunch of grain or other food laying around the refrigerator for too long, or their own kitchen cupboard, and it gets moldy, well, that certainly could be a problem. And the regulatory agencies obviously can't combat against that. I have a policy that when I see one of those 4 Aspergillus markers elevated, okay, I'm going to do I'm going to do a mycotox test. I want to just make sure that we're not dealing with something else. I'm not going to just assume that everything is okay. Because I actually had a guy, as I mentioned, who had all of the fungal markers were normal. He showed up with elevated ochratoxin, I think it was gliotoxin, but he also had elevated markers to Stachybotrys mold. He was being exposed to the very toxic black mold, and he didn't know it. So if I had never done the test, we wouldn't have been able to find that. So as far as the mold marker on the food sensitivity test compared to the organic acid test. So the food sensitivity test is looking at IgG antibody. Because we hear about antibody reactions now with regards to viruses, for example, like COVID, right? So when you have an exposure to something over time, your immune system will produce an antibody against that pathogen, against that agent. And so when we've got an overgrowth scenario or we've got an invasive scenario of Candida within the digestive tract, the immune system, the antibodies are going to get produced against it. And so IgG is really considered to be a memory marker of exposure, whereas IgM is more of a marker that is linked to acute exposure. So the first time we come in contact with an organism, for example, we'll produce an IgM, whereas an IgG tends to get produced a little bit later. So when you have an elevation of IgG, and what the food IgG test does is it gives a range of mild reactivity, moderate reactivity, very high reactivity. It's indicating immune recognition of an overgrowth scenario of Candida. The Arabinose marker on the organic acid test is a chemical reflection of the invasive nature of Candida. So Candida exists as a unicellular state, and as it's sort of laying in there within the digestive tract, some of it, these things are very vulnerable. They can manipulate each other, or the environment can manipulate it to sort of move from a unicellular state to an invasive state. And as Candida starts releasing certain enzymes, it'll break down something called hyaluronic acid. Hyaluronic acid is that intracellular cement in the cellular structures that line our mucosal lining of our gut. And as that breaks down and we start to get invasion of the Candida moving across the epithelial lining, you'll get Arabinose produced as a reflection of that. Now, if that were to occur, let's say acutely, and let's say you did an OAT, and let's say you did an organic acid test, and maybe that reaction was occurring within the past week or so, for example, and you did a food IgG, there may not be an elevation of IgG as a reflection of that yet, because there hasn't been enough time passed or enough invasion or enough immune recognition of that invasive Candida to elicit an antibody response. So in some cases, you'll actually see where the IgG marker is elevated on the food IgG test, but the Arabinose is normal. And in that particular circumstance, what you're looking at in that scenario is there was immune recognition of sort of some invasive nature of Candida in the past. The immune system reacted to it, and now you're carrying a memory marker of that reaction. One of the things about IgG that's interesting is that many forms of IgG can actually trigger inflammation. So there's a triggering mechanism through something called the complement cascade that IgG can trigger, and that can generate some of the inflammatory reactions. One of the things to keep in mind about Candida detection is that it's like anything. These are highly sophisticated organisms. They've been around a lot longer than we have. And sometimes you need to do different kinds of tests in order to get a different viewpoint or a different camera angle, if you will, of an underlying problem. In my experience overall, the organic acid test, if you had to sort of pick one test to start with, is really a great place to start because it's giving you chemicals that are indicating sort of the changes and the dynamics and the reactivity happening within the digestive system, where that may not always be reflected in a stool test or may not always be reflected in a blood test. To me, the stool testing for Candida and the blood testing for Candida are complementary to the organic acid test, not to be used in place of the organic acid test. So I hope that answers that question. As far as the ochratoxin, is ochratoxin exposure more common from food or water damage? From Great Plains' perspective, and having talked to Dr. Shaw and listening and some of the other biochemists, it is more reflective of water damage, of some water damage in the environment, not coming from food. Here in the U.S., if they're in another country, we may not know for sure because other countries may not have the same same regulations over food mold, for example. Make sure I haven't missed anything. Okay. Let's march on a little bit here on this. So I know this talk wasn't about bacteria and Clostridium, but I just wanted to show this anyway. So this individual also has a lot of bacterial problems. In fact, we've got a lot of bacterial markers shown up here under the bacterial section. We do have one marker under the Clostridia section, the 4-hydroxyphenylacetic. If you've heard me lecture before, I've mentioned that the marker HPHPA is the most common Clostridium marker to show up on the organic acid test. Actually, 4-hydroxyphenylacetic is not that common. It shows up maybe between 5 to 10% of the time. So we've definitely got a lot of dysbiosis. What's also interesting in this case is we do have high levels of oxalic. Now, one of the things that can drive oxalate levels to be high is eating oxalate foods, high oxalate foods, but also Aspergillus can produce it. In fact, Aspergillus has an enzyme, and I'm forgetting the name of it right now, but what it does is it will actually produce oxalate directly. And then Candida. Candida has an enzyme called isocitrate lyase. It'll grab the isocitrate, as part of the Krebs cycle, and convert it to glyoxylate. And then glyoxylate gets converted to oxalic acid. So we can get fungal contributions here with regards to the oxalic acid. And so in this particular person, that's most likely the scenario, is that we're getting high oxalate because of fungal production, Candida contribution. There may be some dietary contribution as well. The elevation of glyceric, that can be linked to a need for things like B6 and maybe even some B1. But in this particular case, the oxalic acid is the majority of it is coming from fungal components. Now, as we look at the middle section of page 3 of the organic acid test, all of these markers are actually linked to mitochondrial imbalances, and it gets fairly complicated from a biochemical standpoint. But we'll notice a few things. The first section here, the glycolytic markers, are linked to glycolysis, so the metabolism of glucose. So we'll form pyruvic acid. Pyruvic acid actually gets converted into a chemical compound called acetyl coenzyme A. And acetyl coenzyme A enters the Krebs cycle to help in the production of further ATP. Lactate can be elevated for a lot of reasons, lactic acid, for example, and there's multiple reasons that lactic acid can be high. Sometimes very serious problems, cardiogenic shock, hypovolemic shock, for example, sepsis. And then there can be other sort of less serious scenarios. So a thiamine deficiency, which can be serious, but that could cause it. Alcohol, excess alcohol consumption could cause it. But one of the interesting things about mycotoxins is it does have a strong association to elevations of lactic acid. So this individual is definitely getting some interference effect in their glucose metabolism. We're getting some interference in the ability to metabolize lactic acid, as well as to properly metabolize pyruvic acid. All of that can affect things within the mitochondria, and each of these are different steps or stages in Krebs cycle function. And so we can get interference along the way, moving from one chemical reaction to the next. That can occur because of multiple reasons. There's genetic factors, there can be nutritional deficiencies, and then of course metals and other kinds of chemicals can interfere as well. One of the interesting things that I see is that, and I don't have a slide for it right now, but there is a link between Candida and malic acid. So sometimes you'll actually see malic acid elevated when Arabinose is high. I can't say it happens in every single case, but I see a good percentage, 70–80% of the time, where that is the case. So basically in this person, we've got a mitochondrial dysfunction that is likely occurring because of the presence of fungal toxins, which would include Candida and mold. We also have a lot of bacterial toxins, and we have high oxalate. All of that is known at some level to affect things within these mitochondrial sections. So a lot of times what you'll see is if you go after the yeast and fungal part, you go after the bacterial section, you try to lower oxalates, and you do a retest, let's say 9 months or 90 days later, sometimes you'll just get an absolute improvement in these areas. So this is probably one of the more complicated aspects of the organic acid test, but I wanted to pick this particular case because we can see that there's quite a few markers that are elevated. Okay, so let me go back to the questions here. So the question is, do you ever find Candida alone with no other infections or health issues, or is it primarily an opportunistic pathogen that likely indicates another infection or health issue? Great question. And I very rarely find it as a standalone problem where let's say it became the main issue without something else allowing it to become the problem. These organisms like Candida, I mean, they're part of our natural microbiome, of our ecology of our body. They're part of our natural world. So they can certainly cause problems, and they can be opportunistic in their, what they do metabolically. But when you start to think about fungus in general, and you look at sort of the relationship of fungus in our natural environment, it sort of begs the question in that, is there a symbiotic relationship that might happen with certain fungus, in our body, or, certainly in our food, and how all that relates, to what's happening within us. Yes, they can become pathogenic, and then you get immune reactions secondary to that. These things do produce their own chemicals, and I don't necessarily believe that they're always producing something with the intent to cause us harm. They may be doing it with the intent to get an upper hand on some other competing organism. For example, Clostridia, for example, can do that. It can produce different chemicals that allow certain strains of the Clostridia to kind of, combat another competing Clostridia. It just turns out that it's happening in our body, so our body takes the collateral hit. So by and large, if you're dealing with somebody with a Candida issue and it's an ongoing problem, a recurrent issue, there's probably some other stuff going on. It could be another infection. It could be mycotoxins are allowing it to thrive within the digestive tract. It could be some other metabolic problem, diabetes, blood sugar issues, immune suppression, for example. There's one other thing I was going to say about that, and I'm blanking on it right now. What's really interesting, I actually have, I'm going to show you this. There's an article that just came out. I think it just came out. I just found out about it. And it's from Scientific Reports, dated March 4th, 2019. And it's called Dysbiotic Microbiota in Autistic Children and Their Mothers, Persistence of Fungal and Bacterial Wall Deficient L-form Variants in Blood. So I don't know if you can see this. Let me get rid of this thing here. So this is an article that I recently came across. Dr. Shaw was actually talking about this at a Facebook Live event a couple of weeks back. But what these authors were talking about in here is that, and this was really kind of specific to Aspergillus, and it was looking at autistic kids, which we know a lot of autistic kids have a lot of fungal problems. But they mentioned in here that they suspect that certain children may be harboring and carrying Aspergillus mold in various forms, even as a newborn, where there's the potential it gets passed from mother to child through what's called vertical transmission, because these things can pass through the placenta. And they talk about how an individual who might over time have sort of long-standing exposure, particularly if they're born with these fungal components, may never develop immunity against it. It's so now all of a sudden you have a potential scenario where the mold has just become sort of incorporated into the body. The immune system doesn't even recognize it anymore as a problem. One of the things that seems to happen with Candida is Candida produces an enzyme called invasine, and it allows it to become invasive. So in various forms, you can get Candida through its invasine protein that produces a hypha, this tentacle, this root structure where it can start to burrow itself through the epithelial lining of the gut. And then it engages the immune system that's kind of sitting below that surface. Those hypha can actually be driven right through the tight junction between the epithelial cells. But the invasine protein can also induce a process called endocytosis, where the Candida can actually get taken in intact into an epithelial cell. It's not destroyed, but it's just sort of sitting in there. And what they're looking at is the potential of just genetic information being shared and sort of the symbiotic, type of relationship or scenario. So when you start to take a deeper dive into these aspects of Candida and these other fungal organisms, they're highly, as I mentioned, highly sophisticated and highly complex. And, not always easy to get rid of, or the reality is it's not like we're getting rid of every last single Candida. And that really, in my experience, shouldn't be the goal. What we're really trying to do, if they are causing a problem and causing symptoms for somebody, is to try to sort of knock the levels back as much as possible, with the hope then that our immune system and our microbiome can take over and sort of keep these things somewhat in check. As far as people with kidney disease, I mean, it depends on how severe the kidney disease. I would recommend, honestly, that question, because you're asking about kidney disease and the organic acid test, you got to direct that to the lab. Talk to one of the biochemists in the lab, one of the lab people who works with this. As far as something being equivalent to the organic acid test, I mean, that's difficult because there's not anything that's absolutely equivalent to this test. I guess you'd have to sort of work around it by looking at blood testing for Candida markers, as well as looking at stool testing. But all of these markers from, these labs like Great Plains, they do what's called a creatinine clearance method on urine collections. So, I can't say with absolute certainty that somebody with, in all circumstances of a kidney disease, where it wouldn't be accurate in all, in every circumstance. I would make sure to check with Great Plains specifically on that. So a question about oxalates. What level of oxalates are known to affect the brain in children? I don't know of a specific level. I do know that getting above 90, okay? So for example, if I can go back, let me go back. Seems a little touchy. Getting above 90 in kids has been linked or has been seen in genetic hyperoxaluria. So to be able to get an absolute level with specificity to brain injury is not something I know about. There may be somebody else out there who's done some really intense research into oxalate levels and neurological function. But a level of 447 is certainly elevated and certainly is very, very high. That's really actually high for anybody. So another question is, will Nystatin help to get the Candida or other mold issues under control? Is there any harm in taking Nystatin for the long haul? Nystatin is good against Candida. It's okay-ish against mold, not great. I have had a few cases where I've seen the Fusarium mold go away with Nystatin. I have actually had a few cases where the Aspergillus markers on the oat went away with Nystatin too. But it's not the primary thing that would tend to be used for Aspergillus. If you really have a deep-seated infection, then something like Sporanox is a better option for that. But from a general Candida standpoint, Nystatin has worked extremely well. As far as harm in using it long-term, I don't like using a medication long-term, any medication long-term, if I can help it. And so there's any medication, there's always the potential of some type of resistance that might be developed with these organisms, depending on how sophisticated they are. How Nystatin works is it actually binds to a chemical called ergosterol. Ergosterol is kind of the equivalent to cholesterol as part of our cell membranes. So it binds to the ergosterol, and that causes holes to occur in the cell membranes of the yeast. And so they get leakage of these electrolytes and they die off. The nice thing about Nystatin is that it doesn't get absorbed systemically. So it's not really having any, impact or major impact on liver function. It's a sort of a regionally effective medication within the digestive tract. And so for the most part, it's been well tolerated long-term. And in some cases, it's been used for many, many months, and even some cases, many years. So as far as a medication goes, it's about as good as you can get because of its very, very low absorptive capacity and good tolerance over time. Question here, I'm curious about your experience in seeing yeast or mold markers in oats with patients with rheumatic conditions. I've had a few people with RA that have high levels of yeast markers. I haven't had anybody of recent memory that I've worked a lot with regards to RA and mold and mycotoxins, although I wouldn't be surprised. Nobody that I'm aware of that specifically with ankylosing spondylitis. I haven't personally seen a lot of that in my practice, although I know about it. Definitely a lot of links between ankylosing spondylitis and gut bacteria. So, but the way I work and the way I think about this is that if you've got a lot of gut problems and bacterial problems, there could also be contributing, mold and mycotoxin issues as part of the equation. So I can't say with absolute certainty that, there's an absolute direct correlation in all of those cases, but it would certainly be an area I would look at and look deeper at to see what kind of links you could make. Let me go back here. See if I missed anything. So the question about any suggestions for persistent recurrent intestinal candida. Yeah, you got to start looking elsewhere. This is one of these situations with the recurrent problem, as I mentioned before, because of the sophisticated nature. Looking at food sensitivities, looking at other infections. Are there parasites? Are there other bacterial problems? Is there mold? Is there mycotoxins in the mix? The recurrent issues, it's recurrent, obviously, because the environment and the terrain within the body and the terrain within the digestive system is allowing those Candida organisms to just shift and move and become more invasive. So this really gets back to what else is impacting upon somebody else's body, which kind of goes back to the question that was asked previous to that. Is it likely to see a standalone Candida problem, or is it some other factor that's allowing it to happen? And that's usually what the case is. Let me move on from here in this particular case. One interesting thing I wanted to point out, and I know we're not going to spend a lot of time on this, but in this particular person, they did have elevations of a few of those Clostridium markers, which is very common with regards to causing elevations of dopamine, because the Clostridium bacteria inhibit this enzyme called dopamine beta hydroxylase, and that will cause homovanillic levels to elevate. I don't know of any Candida effects on dopamine beta hydroxylase. So we don't get an effect of Candida on that directly. There is a mycotoxin that is produced by Fusarium mold that can inhibit dopamine beta hydroxylase. It's called fusaric acid. It's not measured on the mycotox test, but it does get produced by Fusarium mold. So it's just kind of something to be aware of. In this particular case, this level of dopamine is occurring because of the Clostridium bacteria. Now, this person also has a number of markers elevated in the pyrimidine section, looking at folate metabolism. I could spend hours talking about the influence of toxins within the methylation and folate cycle. But it's not uncommon to get imbalances in folate metabolism, whether it's absorption or utilization, in the presence of high amounts of gut problems, including yeast, mold, bacteria. Same thing is when we start to create problems at the cellular level, either through absorption or transportation of nutrients into the cell. We often have to look back and say, do we have toxins that might be interfering with some of these things metabolically? And in this particular case, we've got mold exposure, bacterial exposure, high yeast. These things seem to commonly be associated with just kind of interfering with the way things function at the cellular level, and that also includes the mitochondrial section. One of the things on the organic acid test is that the ketone fatty acid oxidation section has a strong link to mitochondrial activity. So a lot of times when you see imbalances in the ketone fatty acid section, you'll also see imbalances on the primary Krebs cycle and other mitochondrial markers found on page 3. One thing I want to point out, if you do organic acid testing, is it's very common to see elevations of this marker called glutaric. which is linked to riboflavin. And riboflavin is vitamin B2, is needed a lot in the body with regards to metabolic activity, mitochondrial activity. But it's interesting in that you'll commonly see glutaric levels elevated when Arabinose levels are high, or some of the other yeast markers are high too. And I think the reason that's happening is that these yeast organisms, when they metabolize glucose, they form a chemical called acetaldehyde. Now, aldehydes are chemicals that carry, they have a hydrogen and a double bonded oxygen. And this chemical group is highly reactive in the body. And so it's interesting when you look at things from a chemical standpoint, much of our liver detoxification processes, particularly in phase 1, which is our P450 system, is heavily weighted to sort of detox and transform these aldehyde chemicals that many times we'll produce naturally within our body, or we come in contact with, externally. So the classic thing is you drink alcohol, you'll convert it into acetaldehyde. Well, yeast will take glucose and convert glucose into ethanol. But the step prior to that is it forms acetaldehyde. And you get a lot of aldehyde buildup. It has its own toxicity issues. It can damage mitochondria. It can cause free radical damage. It can damage proteins. It can damage cell membranes. And it turns out that our body will convert acetaldehyde into acetic acid as a way to detox and get rid of the buildup of acetaldehyde. And we need riboflavin as a cofactor in that function. And so it's quite possible that when people have a lot of Candida, a lot of yeast issues, they may be building up acetaldehyde within the system to a certain point, and it's requiring a lot of B vitamins, specifically B2, in order to convert it into a less, a reduced toxic form, if you will. Okay, let me go back to the questions here. Yeah, so somebody asked, you mentioned above 90 in oxalates, which marker? It would be marker 21, so it's the oxalic acid. Okay. Some really good questions, everybody. Really super good questions. I'm just reading a question here. Let me see. So the person, a good question goes, in your experience, how often is a fungal exposure a potentiating factor for chronic candidiasis? Well, quite common, actually. So candidiasis would be a fungal problem, but okay. So that, just kind of keep that. I found it very hard for people trying to completely heal from dietary measures. Antifungals and symptoms are often recurring. Right. That kind of goes back to this sort of running theme, right? It's this, I mean, it's not as though Candida just becomes a problem all by itself, right? Our body allows it to happen. So let me just give you sort of a dramatic scenario. I remember years ago when I was in my internship, and I was doing, during my internship, we had to do a month of nights. Basically, that meant you were on call overnight in the hospital. So all of us had to do that for at least 1 month. And there was a young woman, I remember, who had abdominal cancer. I mean, she was in her 30s. And so she had, part of her intestines removed, and they had her on, different drugs and whatnot. And she ended up developing a fungal infection. And they actually had her on amphotericin B. And I remember at one point, they figured that she had a very severe Candida infection that was now infiltrating her body. Candidemia, it would basically be called. And she ended up dying of a systemic fungal problem, this candidemia. And it was really saddened and traumatic, for at that time, and maybe at any time, in your medical training. But it taught me a lesson that these things can be extremely powerful in the right circumstances. Now, she was immune suppressed, right? She not only had cancer, but just the mental, emotional stresses of going through that process, going through surgery, and then being put on very powerful medications, it just caused immune suppression, and she got, this infection that ended her life. And so, that's not a common scenario for any one of us, typically in just a regular integrative functional health kind of practice. But the Candida didn't become a problem on its own. It didn't get to that level until other factors were happening in her body that allowed it to become an issue.
Dr. Miller, we have about 3 minutes left.
Oh, all right. Let me go back here, Daniel. So real quickly, I wanted to show you, this is this individual's detoxification section. So we have all of this mold, Candida, Clostridia, okay, effect going on. We've got a glutathione deficiency, right? And then we've got some other stuff. Uric acid is high. That can be due to ammonia excess. That's a lot of times comes from gut problems. So a lot of detoxification issues. Let me see if I can get the slide. So before we end, everybody, I just want to let everybody know that we actually have a new course coming up through our Integrated Medicine Academy. And it's called the Candida Mastery Course. So it's scheduled to start early June. I think it's June 3rd. This is going to be a very in-depth course on Candida and related problems. We're going to be talking about different pathogenicity mechanisms. We're looking at different, let me go back, different lab testing and how to interpret it, how to kind of line up that information, different clinical presentations, different types of chronic health issues that can be linked to Candida, looking at autoimmune, neurological, mental health, cancer, chronic digestive problems, etc. And a ton of information with regards to different treatments, from medications to botanicals to supplements to probiotics to microbiome diversity. So for more information, you can go to Candida Mastery Course. The website right now is still being developed, the homepage. But if you want to get on the list, you can text Candida to 66866, or you could simply just go to candidamasterycourse.com and put your name in there, and we'll notify once the course is up and ready to go, as far as promoting its sale, and the website, the homepage is being developed. So anyway, Candida Mastery Course that starts in early June. And Daniel, I know that you mentioned we're almost out of time. Let me see. So let me answer this one last question, okay? If a patient were to retake the OAT test after getting on Nystatin, should they stop taking the Nystatin when doing the follow-up test? My personal approach is I do not have them stop. So, and the reason why is that I want to see if our treatment has actually worked. I've actually had situations where an antifungal was stopped, and whether it was for a week or a couple of weeks, you come back and do the OAT test and the levels are elevated. Well, you don't know, are they elevated because the yeast just came back, or did the treatment not work to begin with? So I actually like to retest people on follow-up while they're actually on their antifungals to actually see if they're working. Okay, I think we are out of time, as was indicated. So I think this worked out well. Great questions, everybody. Thank you. Very insightful, by the way. I appreciate it. I hope I was able to answer everything as best as possible. Yeah, so again, check out the course, Candida Mastery Course. If you're interested, reach out to us if you have any questions. I am Dr. Kurt Wohler. Thanks so much. Have a nice day. Take care.